Hello, I'm Dr. Jaydeep Palep, Bariatric Surgeon based out of Mumbai, India. By the end of this video, you will know what is robotic bariatric surgery, what are the advantages of robotic bariatric surgery, and which is the country which is offering robotics in a very large manner for surgery. All these things are what we're going to talk about. If you want to know more about bariatric surgery and its various types, please follow the link in the description given below. We have already uploaded a video for that. Robotic technology has been growing in the last few years across the globe. It is one of the best technologies present for complex procedures. By the end of the year 2015, more than 33,000 robotic surgeries were performed world over. By the end of 2022, that is in 7 years down the line, more than 100,000 robotic procedures were being done annually across the world. So it basically has a robotic cart and a console. The console is where I sit as a surgeon and control the robotic cart, which has 4 arms, which have the ability to take tiny incisions and put in those instruments, and those instruments are controlled by the surgeon on the console, and those instruments actually are so sophisticated that they give you 360-degree rotation at the tip of the instrument along with a 180-degree depth perception. So that is a total of 540 degrees, whereas the Luminant can only give you a 360-degree rotation. The key advantages of robotic surgery are vision, because we have a magnified 3D view, precision because of the instruments which are giving us 540 degrees of motion at the tip, and control because it is all controlled by the surgeon, unlike in traditional conventional laparoscopic surgery. Because of these advantages that the robotic technology offers me as a surgeon, the pain factor really goes down in comparison to conventional laparoscopic or minimally invasive surgery that we have been doing over the last few decades. And the patient stays in the hospital for a shorter duration. It means that your hospital costs come down, and also because you're resuming work earlier, there is not a loss of income to the patient. There are special situations where this robotic technology comes very handy in bariatric surgery. What are these special situations? One, when a patient is suffering from class 3 or class 4 obesity, or also known as severe obesity or super obesity. In these patients, the robotic technology or the robot actually helps us hold the abdominal wall much higher and allows me as a surgeon to perform the surgery with great ease, and obviously hence improving the outcomes in comparison to conventional laparoscopic surgery. The other advantages are where in these super obese patients, the left lobe of the liver is really large. It allows me to see better, lift the left lobe of the liver better, and hence again the surgery becomes easier and faster, which means that the anesthesia time for the patient is much lesser, and hence that also contributes to an early recovery. And lastly, there are situations where patients have undergone abdominal surgeries in the past on their abdomen. In all these abdomens, there are a lot of adhesions. One organ is stuck to the other. To remove these adhesions in a better manner, the robotic technology helps us in a great fashion. And one of the last important things with respect to robotic technology in bariatric surgery is what I have experienced over the last decade and a half is when we have to do revision bariatric surgery. What is revision bariatric surgery? So you've already undergone a bariatric procedure in the past, maybe 5 years back, maybe 10 years back. That's when you have come up with a new problem and we have to go inside and correct that problem surgically. This is where the robotic technology scores over every other technology possible and gives a fantastic outcome for the patient. As one of the only robotic bariatric surgeons in the western part of India, I'm really proud to offer this cutting edge technology for the benefit of my patients. And if you want to know more about robotic bariatric surgery, feel free to reach out to me through the various channels which have been mentioned below, and I'll be glad to help you and offer the same benefit that I can offer to all my patients.